Welcome to Health Bulletin. In today's video, we are discussing a pressing issue that has far-reaching implications for India's future: childhood obesity. Childhood obesity in India likely to rise 9.1% annually by 2035. World Obesity Federation says obesity among boys and girls in India is likely to see an annual rise of 9.1% by 2035 if prevention, treatment, and support do not improve. In 2020, boys had a 3% obesity risk, but this is projected to quadruple to 12% by 2035. Similarly, girls faced a 2% risk in 2020, which is expected to more than triple to 7% by 2035. Adult obesity is also on a steep rise, with an annual increase pegged at 5.2%. This is a significant public health concern. Focusing on India, the report highlights worrying trends. For Indian women, the obesity risk was 7% in 2020, but it's expected to almost double to 13% by 2035. Indian men are not far behind, with their risk increasing from 4% in 2020 to 8% in 2025. The reasons for increased obesity prevalence include rising trends in dietary preferences towards more highly processed foods, also greater levels of sedentary behavior, weaker policies to control the food supply and food marketing, and less well-resourced healthcare services to assist in weight management, and lack of health education in the population. Further, the report showed that lower-income countries are facing rapid increases in obesity prevalence. Of the 10 countries with the greatest expected increases in obesity globally, 9 are from either Asia or Africa, including India. Globally, more than 50% of the world population will be living with overweight and obese by 2035. More than adults, childhood obesity could more than double by 2035. Boys are likely to see a 100% increase, while girls can see a 125% increase in the risk of obesity. Overall, 1.5 billion adults and nearly 400 million children will be living with obesity in 12 years' time unless significant action is taken. This year's atlas is a clear warning that by failing to address obesity today, we risk serious repercussions in the future. It is particularly worrying to see obesity rates rising fastest among children and adolescents. Governments and policymakers around the world need to do all they can to avoid passing health, social, and economic costs on to the younger generation. That means looking urgently at the systems and root factors that contribute to obesity and actively involving young people in the solutions. If we act together now, we have the opportunity to help billions of people in the future. The report also predicted that the global economic impact of overweight and obesity will reach $432 trillion. In the case of India, the impact of obesity on the national GDP would be 1.8% by 2035. However, the report emphasized that the acknowledgement of the economic impact of obesity is in no way a reflection of the blame on people living with obesity. What about obesity in adults in India, the most populous country in the world and where undernutrition has been the major public health concern over the past several decades? Little attention has been paid to obesity until recently. The emerging evidences suggest an increase in obesity in adults. Obesity is a result of energy imbalance in the body, where the energy intake from food exceeds the energy expenditure through physical activity. Maintaining a balance between energy intake and expenditure is essential to prevent the deposition of excess fat mass in the body. It is recommended to perform certain physical activities to expend excess amount of energy. A recent study on the pattern of physical activity in India revealed that a significant proportion of the Indian population, 57%, is physically inactive or only mildly active, and females are less physically active than males. Physical inactivity is highest amongst the South Indian population, 72%, making South Zone more vulnerable to obesity and subsequently to chronic illnesses. The rural economy is undergoing an economic transition and has resulted in withdrawal of significant proportion of female workforce from economic activity. This also indicates the possibility of decreased physical activity in women, particularly in rural areas. Few studies have established that transition from agricultural labor to wage labor decreases the physical activity of women rather than men. These findings underscore the importance of promoting physical activity, particularly among women. Encouraging regular physical activity can help individuals maintain a healthy weight and reduce the risk of chronic diseases associated with obesity. Policymakers and healthcare providers must prioritize initiatives that promote physical activity and encourage individuals to lead active lifestyles. In India, tribes are attributed to be the most disadvantaged socio-economic groups. The findings of the present study suggest that the tribal have a lesser prevalence of obesity amongst the social groups. Abdominal obesity is not found to be strongly associated with the scheduled tribes in India, which comprise 808% of the Indian population. Many studies have indicated a high prevalence of malnutrition among adults and children of scheduled tribes. According to other studies, some key factors contributing to malnutrition among the scheduled tribes are low scores on Wealth Index, low access to health services, and lack of education. Indeed, as individuals move higher on the Wealth Index and secure better access to health services, they may become more vulnerable to abdominal obesity, particularly women in these social groups. Further studies on specific social groups such as scheduled tribes would provide a comprehensive analysis of unique health risks arising out of double burden of malnutrition. Amongst the religious ethnic groups, Sikh women have a stronger association with obesity in comparison to Hindu, Jain, or Buddhist women. Sikhs are a religious minority in India, comprising of 1.72% of the population. Most Sikhs are wealthy, and that is the reason why most of the Sikhs in the sample of NFHS 5 survey also make up to the higher wealth quintiles. As Sikhs make up a significant proportion of the population in Punjab, initiatives that specifically target this community can help address the issue of abdominal obesity. The government of Punjab should take notice of the prevalence of high abdominal obesity amongst the women in the state of Punjab, and more specifically amongst the Sikh community. As for Jains and Buddhists, while they may follow an austere lifestyle, it is still important to monitor and address any potential health risks, including abdominal obesity. While they may be small religious and ethnic minorities, every community deserves access to healthcare and support for healthy lifestyle practices. Obesity has conventionally been recognized as an issue pertaining to urban and wealthier sections of society. This difference could be due to various factors, including changes in the rural economy and increased proximity to urban centers. As the share of agriculture in the overall occupational structure decreases and non-farm activities increase in the rural economy, there is a greater likelihood of rural residents being exposed to economic opportunities. This may lead to changes in food consumption habits and a shift towards processed foods, which are often high in calories and low in nutrients. About 1/3 of the women aged 15-49 years in rural areas are also found to be abdominally obese. Better accessibility to nearest town is likely to increase the exposure to economic opportunities. Understanding these factors is crucial for developing effective policies and initiatives to prevent and manage abdominal obesity in rural areas. The wealth of the households emerged as a potential differentiator of abdominal obesity amongst the Indians. Reduced physical activity owing to organized work and mechanized transport, particularly for the wealthier sections of the society, has led to the adoption of a sedentary lifestyle. Consumption of fat-rich diet is one of the factors that explains the higher prevalence of abdominal obesity in the wealthier sections. As per a research study, higher income groups consumed a diet where 32% of energy was derived from fat, while for the lower income groups, only 17% of energy was derived from fat. A study on dietary pattern in India informs that the Indians consume 10% of the average total caloric intake from processed food. Urban households, in the highest income group, lead this nutrition transition with consumption of almost 30% of their total daily calories from processed food. Amongst the different regions of India, the calorie share is highest in South India. NFHS 5 report provides additional information on the diet pattern found in the country. The report reveals that majority of the Indians are now non-vegetarians, who either regularly or occasionally consume egg or meat. About 45.2% of the women and 57.3% of the men consume egg or meat regularly, either daily or at least once in a week. Studies across the world have demonstrated that meat consumption is associated with abdominal obesity. Aerated drinks, sugar-sweetened drinks, a potential contributor of obesity, is consumed regularly, at least once in a week, by 15.5% of women and 24.6% of men in the country. Availability of rice and wheat as major staple crops for the disadvantaged socio-economic groups through the public distribution system has led to a better consumption of carbohydrates by them. Indians are shifting to non-vegetarian diet, processed foods, aerated drinks, and carbohydrate and fat-rich foods. India has complex socio-economic cultural heterogeneity. Family health surveys in India should cover in-depth information on dietary habits and physical activity in future. More data and research on these aspects will help the policymaker design better targeted public health interventions. Men and women differ in the patterns of fat deposition and fat utilization by the body. Women generally have a larger proportion of body fat mass as compared to men. Estrogen has an effective role in distribution of fat deposition in women. It appears to be protective against abdominal fat deposition in women in reproductive age group, But the loss of estrogens after menopause, independent of aging, makes women more vulnerable to abdominal obesity. The prevalence of lower sedentary metabolic rate in women compared to men also explains prevalence of relatively higher abdominal obesity in women. A comparison of BMI, waist circumference, and waist-to-hip ratio for the same population of women would be useful to identify those with a healthy BMI but high waist circumference. High BMI is an indicator of a metabolic risk. Many studies have examined whether middle-aged, 30-49 years, weight gain in women is a function of aging or hormonal changes, and it has been found that the steady weight gain of half a kilogram annually during midlife is due to age. There is a need to conduct future research using all the three measures to enhance an understanding on the factors causing weight gain, be it hormonal changes during menopause, physical inactivity, or nutritional habits. Obesity is a complex phenomenon, and its risk factors are numerous and mutually interactive. Given that a significant proportion of the country's population lives in rural India, the burden of abdominal obesity and its associated risks could become overwhelming in no time. Further research is needed to understand the health risks associated with abdominal obesity. The health and wellness centers launched by the Government of India under Ayushman Bharat are a good start to introducing wellness programs in urban and rural areas. Thank you for watching this important video. If you found it informative, please subscribe to our channel for more content on health and well-being.